So with that, Vanessa, we turn it over to you.
Thank you so much. As Molly mentioned, I work at Channel 8. I'm an investigative reporter here. I have the newsroom behind me. And so October is Dental Hygiene Awareness Month, and COVID-19 has really affected people and their oral health. They might be afraid to go to the dentist. Closures have denied at-risk populations access to resources and screenings, but there are safety precautions in place. I just recently went to the dentist and I saw that firsthand. So we really want to address this again since it's October and Dental Hygiene Awareness Month. So I'm going to introduce our panelists, Dr. Amy Tongsiri, with the Nevada Dental Director for Liberty Dental Plan, Dr. Mark Funke, President of the Nevada Dental Association, Dr. Rhonda Everett with UNLV Associate Professor in Residence, Dr. Erin Green, Director of Advanced Education in General Dentistry with the Residency Program for Roseman University College of Dental Medicine. So I hope I said all of that correctly, kind of winging it here, but thank you everyone for joining us. So let's start with Dr. Everett. Can you talk about scheduling your appointment and also the safeguards that are in place?
Yes, well, it's really important to schedule and keep your dental appointments. As we know, maintaining good oral health is key to achieving good overall health. So if you've seen your dentist this year, that's great. Make sure you stay on your schedules with your appointments. If you haven't seen a dentist this year, it's important for you to schedule an appointment at least for an exam and a cleaning. Now, when you go into the office, you may see that some changes have occurred. For example, here at the UNLV School of Dental Medicine, we do a brief COVID screening on all patients entering the building. When they arrive, we'll take their temperature. We'll make sure that they're wearing a face covering. We'll also make sure that they are wearing that face covering throughout the building until they get to the operatory. Once they're seated, they are asked to rinse for about 30 seconds with a mouthwash, and they have to do that before anyone actually sees them, whether it's a student, a faculty member, or a hygienist. What you will notice too is that we as dentists will be wearing more personal protective equipment. So in the past, where we just wore the mask and maybe the eye coverings and gloves, now we've amped it up a bit. We're doing head covers, we have face shields, and even some of us in some cases wear shoe coverings. So you will see that as a change as well. We are here at the school using fewer powered instruments, so we're going back to instruments that we're using for the scalings and root planings a lot of times, and that is in the cleaning. What you may have seen in the past were the ultrasonic scalers that generate a lot of aerosol, but now we are going back to the basics. And another thing that you may notice in your dental office is four-handed dentistry. So every operator has an assistant that is there helping them. Again, we can't stress enough how important it is to keep up with your appointments. You'll see a lot of changes in dental offices throughout the state, but that is for the benefit of the patient, the safety of the patient, and the safety of the dentist as well. So make sure you continue to schedule your appointments and keep those throughout the year.
Thank you. And Dr. Everett, I mean, Nevada has been hit so hard by unemployment. So what should people do if they need to go to the dentist and they've lost their insurance?
Yeah, that's a difficult one. We're all aware that the pandemic has caused many people to lose their jobs or have a reduction in salary or maybe lose their health insurance or dental insurance. So here's a few steps that they can take in order to ensure that they're getting dental care. So if they have a regular dentist, call your dentist and see maybe if they're giving a special or offering some type of decreased rate for people who have been financially impacted by the pandemic. If you live in Clark County or near Clark County, we are more than welcome to take you here at the dental school. You can receive great dental care at a discounted rate. And also with that, you'll be contributing to the education of future dentists in Nevada. But we want to make sure that, you know, everyone is seeing that we are giving affordable care, but we're giving good care as well.
So can you just a follow-up question, what should a typical cleaning or checkup cost someone?
Well, that's going to vary, and I'm sure each office has their rates. And for the dental school, that will vary with insurances and things like that. But it is definitely affordable. And at the dental school, the rates are cheaper or more affordable than I would say someone who is going to a private practice. So if they're willing to spend the time, again, they're going to get great affordable care at the dental school.
You talked in detail about safety earlier. There's also a new study though. Can you talk about that?
Yeah, so there's a study that's the first of its kind that was done that's in the Journal of American Dental Association, that it says fewer than 1% of dentists nationwide when tested for COVID were found to be positive. So the dental practices have been safe in the past, and we've even amped that up. And so we are one of the professions, based on the data that was collected in June of 2020, that is one of the safest professions that you can have out there right now that will, you know, take care of your dental needs.
Thank you so much.
Absolutely.
Dr. Green, you know, people may get a checkup, right, every 6 months or every year. Why is it important to maybe not wait it out for 6 months or a year? Why is it important to keep up with the routine?
That's a great question. And I'm going to talk specifically about kind of the patient population that we see here in our clinic. And I would term them high caries risk patients. What that means is they're patients that are at significant risk for having dental cavities. That's either from the diet that they consume, or it's from a lack of education about how to properly brush and floss. So, you know, there may be an individual out there that could go for a year. Like if you've been to the dentist routinely through your life and you don't ever have any cavities, maybe you can wait. But if you're someone that's never visited a dentist regularly, or you're someone that's had a lot of cavities in the past, you are at risk. And what can happen is you may think, oh, I'll just wait 6 months until COVID's over. Let's say that's what the patient is thinking. But you could go from needing a small filling to something extreme, like needing your tooth removed, because that cavity can progress so far in that time that you've waited. So it's really, really important. One of the difficult things I think about teeth for the general population is oftentimes you can have a major problem and there's no pain associated with it. So by the time there's pain, it's so far gone that we might have to take the tooth out, that's beyond saving. So there's not those triggers like sometimes we have in other parts of our body that something's wrong. So it's really important to go, you know, every 6 months, even during COVID, and get those checkups.
Can you also, we touched on this before, the safety precautions, but again, can you also break down the role the patients should play with safety and the role that the staff should play? Absolutely.
And I want to, for anyone that's watching this and is having fears about going to the dentist, first, I just want to say I sympathize with that. As everyone else was, we were shut down for 3 months last spring. And the thought for me of going back to work was scary. I thought, man, being a dentist right now, you're so close to other people. Is that something that we should be doing? But I'm thrilled to say, you know, we came back July 1st with our new group of residents, and we came back with no restrictions as far as what procedures we're doing. Like Dr. Everett spoke about, we are screening all patients that come into the building. We're lucky enough to be a small enough clinic that we're doing a virtual waiting room. So patients are waiting in their car, and then they call us when they've arrived. And so we don't have a waiting room full of people. And like Dr. Everett spoke about, they wear masks, and then they come back into the operatory. We have all the same precautions she spoke about. In addition, we've been lucky enough to purchase some external suction units. So for those of you that have been to a dentist and have had a filling or something done, you know, the assistant holds a suction unit. But we have these external units now that are just way more powerful than what the assistant holds. So we're using that in addition to what the assistant does. So all those things combined, and I'm happy to say now, you know, we're 4 months into being really busy, not limiting any procedures we're doing, and nobody on our staff, faculty, residents has been sick. We've had no patients that have tested positive for COVID after being in our clinic. So I'm to the point now where I feel completely comfortable at work. I feel like everything we're doing not only keeps everyone working here safe, but our patients very safe. And so I encourage everyone to just go on with visiting your dentist and your other healthcare providers. You know, one of the problems with COVID is that people are neglecting all their other health issues because they are afraid. But I feel confident in saying, please visit your dentist.
Thank you so much. Dr. Funke, can you talk about whether you think that most dentists in our state are following these precautions and why you feel that it is safe to go?
Yeah, obviously all these dentists, we're all professionals. We went in this profession because we care about people. So no one's going to try to cut corners and neglect anybody. Now, where you're going to see differences is the size of the office or the size of the clinic. If it's a single office where a single dentist has a couple hygienists, some auxiliary staff, well, their guidelines are going to be a little different than, say, a clinic that might have, you know, say, a dental school. You know, they've got 20 students or more that are in there. So you're having to adjust and limit the number of patients that are in at the same time. Separating the staff, social distancing, so all that comes into play. So everybody has to look at their individual offices to basically their needs and to care for the patients. So one of the downsides of that too, though, is yes, we want patients to come in, but we're also not able to see the same number of patients in a given day, because we aren't overlapping them where you've got, you know, 1 or 2 patients waiting in another operatory at the same time. We are stacking them just, you know, kind of one at a time. We don't have people in the waiting rooms. We don't have our patients coming with guests, you know, unless that person is, you know, a younger child, they have to have a parent with them, or somebody needs some other additional healthcare needs and assistance.
And so some people might feel more comfortable maybe taking a trip to their primary care doctor, maybe to get the flu shot, but maybe they are still hesitant to go to their dentist. But dentists are doctors. Can you talk about that?
So, you know, that's interesting in a couple aspects. That when you talk about the family practice physician, now, yes, those physicians, they've gone through training, they've had to use infection control, but you look back in history, you know, they really didn't use much in those facilities, and half the people in their waiting room were ill to begin with, and everybody's mingled around them. So they've had a challenge with COVID of having to teach all their staff how to use all these personal protective equipment, infection control. So it's been quite a stumbling block for them. Whereas with us dentists, I mean, it's second nature. We've been doing this for, you know, what, over 40 years. As you know, Dr. Everett, Dr. Green has already mentioned, we've just added a couple of extra protocols. We've been safe. We're experts in this field. Now, when it comes with the vaccinations, we have kind of 2 initiatives we've been working on since day one, since COVID hit. It's already within our scope of practice to administer the vaccinations, but, you know, you fall into the NRS statutes, making some regulations that outline some of that. So right now, with the 2 initiatives we have, the first one being that we're ready to go, that we can help with the governor's emergency mandate initiative, where we can help to administer the COVID vaccination, you know, if or when it becomes available. The other one that we've been working on is the more permanent administration of the vaccines, you know, once this pandemic's over. So, and it's going to be all vaccines, and it helps with just access to care if we're out in rural areas caring for people, helping with a number of patients in the public that need it, kids, school-age kids that have to have vaccines before going to school. So it's not only a vaccine for COVID, it's all of them across the board. That's us helping as a healthcare provider. So yeah, people will refer to people as a doctor, dentist in a sense, but they're just clarifying us in our specialty within that healthcare realm.
Can you talk about the Nevada Dental Association's role in planning for vaccines that you mentioned?
Oh gosh, so many facets. I mean, I haven't been busier. You know, obviously every president's gotten hit with this. We were restricted for the first 2.5 months, and my phone started at 5 in the morning, would go to 11 o'clock, 7 days a week. You know, just working with the State Board of Pharmacy, the medical advisory team, particularly Dr. Arisen, the Hospital Association, Health and Human Services, directly with Dr. Antonia Capurro, who's our state dental health coordinator. Her and I particularly started this at the onset, talking with all these folks, how can we help? Because then we had the Battle-Born Medical Corps developed where we can come in to help. You know, if we're going to a hospital to help, obviously we can just help with certain areas. We aren't trained with the ER part, but then at the same time, the ER physicians aren't trained with what we do. But we can get in there if we can help with, you know, more of the vaccines, administering with that. It's just a greater care for just all the public. I mean, if you figure you're going to have more public person or people in general than you will have providers. You know? So we've already reached out to legislators as well. We've done some, if you want to call them interviews, had meetings with them. We've already got a BDR that's going forward with our state legislative session this year to make it more permanent. So there's actually quite a bit involved. It's not one of those quick things. We've been doing it for months now.
Thank you so much. Dr. Tongsiri, can you talk about how the school closures have impacted the Medicaid population?
Yes, definitely the school closures for Clark County and Washoe County have heavily affected all the children in the school district, and especially our Medicaid population, where we were able to before go in and do community oral health presentations, or Future Smiles would be able to go in and do school-based sealant programs along with UNLV. So without these types of programs, this was a resource where a lot of the children were able to be seen at school. You know, a lot of our Medicaid population does have trouble getting, you know, the kids into the office for traveling or, you know, work reasons. And so this was a very easy way to at least have some type of screening for the kids, and also to apply some preventative treatments. So this has been very tough for our population, just because we do see a higher risk once the children are getting back into the offices. The decay, as Dr. Green has stated, is probably already deeper. You know, at this point, most of the kids are only coming in when it really hurts. You know, a lot of people are still nervous about the preventative treatments. But when they do come in, the decay is either a baby root canal or an extraction at this point. And a lot of it is just because we're not having that source of communication. With the schools being closed, we're also worried about snacking, as far as like Halloween is not the only time, but with the schools being closed, the kids were on a regular schedule. You know, they at least had breakfast, lunch, and dinner and snacks in between. But with kids being home now, we're definitely seeing more just snacking throughout the day, probably juice and soda throughout the day, not as scheduled as we would see with the schools.
And can you talk about community resources to try to address that?
Yes, there are community resources that we are partnering with our partners in the community. So in Washoe County, we have partnered with the dental office, Small Smiles of Reno, with Dr. Mann, and we're providing oral screenings it's a drive-by fluoride clinic. So every other Saturday, families are able to come to our locations where we have Dr. Mann, his team is set up either at a park, a Boys and Girls Club, in a parking lot, and you can drive by. We have partnered with Immunize Nevada and also local food banks to also get other resources while you're at this event. And so we have dentists and assistants on staff in proper PPE, just doing oral screenings and placing fluoride varnish. Last Saturday, we served 70 kids, so we thought that was pretty good for a few hours. Again, our biggest concern is just getting to some of the children who we're unable to see regularly. Down in Clark County, we're also partnering with Future Smiles, and we're going to a lot of local events where I think Mater Academy or Health Plan Nevada, other local partners are having community resource events. Any event that we can be at and we can support, either by giving oral hygiene kits, partnering with Future Smiles and providing preventative services, providing education, resource table, letting people know where to go if they have Medicaid. We'll do case coordination. We'll get them into their dental home. We'll arrange some transportation for them. So we're out there in the community just trying to do as much as we can. I also wanted to say that we do have also teledentistry is a big resource that we've been utilizing a lot with our Medicaid population. So for our providers, we do reimburse for teledentistry during COVID office closures. Liberty actually took on taking a lot of teledentistry in-house emergency calls because all of the offices were closed. And I think just like this, being able to have some face-to-face interaction and connecting with your provider and saying, maybe take some Motrin over the counter, we'll get you in as soon as we can into another clinic, or, maybe this can wait or this cannot wait. So being able to kind of triage that during COVID was very helpful. And now we are definitely looking at teledentistry as another resource of access to care. If people are still worried about going in, we definitely want them to utilize this service.
And earlier you mentioned perhaps some might be skipping the preventative care and then it could lead to something more like a root canal or something like that. But are there other health issues that can result from skipping that preventative care, something more serious?
Yeah, I mean, definitely gum disease has been linked to a lot of things. Other health conditions, like you said, for children, I would say they don't really, they may not always have their voice of pain. A lot of times we say, everybody has a voice, but they may not always speak about it, So even with some of these teledentistry calls, the children were having abscesses, large abscesses. This could affect their permanent teeth. Like you said, these infections could get into their bloodstream. So there are definitely bigger concerns without being able to kind of just have an oral surveillance on this population.
Vanessa, could I add something?
Sure.
Just to speak now to the adult population, one thing that we do with all of our patients is we take their blood pressure at every appointment. And so obviously we're not going to treat someone that has high blood pressure, but it's a nice way to screen patients who may not be visiting a physician regularly, that we can educate them, your blood pressure is really high, here's why that's dangerous, and then get them to a physician so that they can have that evaluated and treated if necessary.
Thank you. Question from George McCabe for Dr. Funke. What do you think is the biggest misconception that people in Nevada have right now about visiting their dentist?
Well, probably two things. One is, as you know, there's so many different, misinformation that's out there. Just the understanding of COVID, how you can contract it, the people who are more at risk than others. So you've got people across the board from, as you know, some people that are, not concerned with it, to others that I still have spoken to that haven't left their house yet. It's devastating. So the patient coming in, their misunderstanding of how that virus works, our infection control protocols, and to seeing how other businesses do it. It's, as I mentioned, we're specialists in our infection control, but then when you've got somebody that's going to a grocery store that, okay, great, you have to wear a mask when you go in there, but how great is that overall when people are touching things, the carts, the groceries, and coming out, they're not being screened. We've always, indirectly, if you will, screen our patients before coming in. If they were at all ill, hey, they never came in. We've already done that from day one, but now we have those extra protocols too, where we're asking the additional questions, we're taking the temperatures, we're doing just a little bit more. So when you see the two different safety measures between the different businesses and ourselves, I think that is really confusing to them as well.
Also, a question from George McCabe. How has COVID-19 impacted your business and for your business and other dentists in Nevada? And do you feel like more patients are coming back or they're still waiting?
It's like every business, of course, it's impacted us greatly. We were restricted for 2.5 months to only doing emergency treatment at the time, you know, to help flatten the curve, help direct personal protective equipment. Of course, when we're coming back now, we're, you know, we still have all those expenses that came in. We've got our employees. Every office is a little different in that regard. I like to think that we've got a great office. Every one of my staff members came back. They are not concerned. They've always trusted what we've done here. All of our patients have come back with the exception of some that do have some underlying health conditions, but they were ones that, you know, another panelist earlier said that, hey, they come in regularly, you can postpone it a little bit till things settle down, they feel more comfortable. Not being able to see the number of patients, because it still comes down to, you know, trying to care for the people. The cost of the supplies have become astronomical. You know, our masks alone have increased by 200%. We have other supplies that have increased by 2,000%. So the cost of providing dentistry is gotten astronomical right now. So.
Wow, thank you for sharing that. And I just want to mention, if anyone has any questions, please just put your question in the chat box and I will ask that for you. And a question from Jennifer Bradley. How are we training future dentists for Nevada and mentoring them during COVID? Is there a difference in training? And I think I'll ask Dr. Everett. Could you weigh in on that?
Yes, well, I mean, we've always in the dental profession trained our dentists to be good at infection control. So now it's become a norm now with their education that this is a part of what needs to be done. So the extra precautions aren't even extra anymore because they're coming in and this is our standard now. You know, we've raised the bar, so to speak. So they are constantly, you know, this is being reinforced in the clinic. This is being reinforced in their didactic courses and their infection control courses that, again, you know, these are things and precautions that have to be in place in order for you to care for your patients. So we've always in dentistry had the standard that infection control is important, and we've just kind of amped it up a little bit. And this has now become our students' new norm, so to speak.
Thank you. And I'm going to actually ask a follow-up to Dr. Funke. You mentioned the cost has increased to provide that care. Do you feel like that cost is being passed on to the patient at all?
For the first couple of months, a lot of offices had just a little additional infection control fee, if you will, whether it was $10, $15, just to try to help offset it. But a lot of those have been removed and offices are just absorbing it. You know, they're doing what they can to help their public because we are part of this state and this union. So as far as everybody that I've talked to, nobody's has raised prices. They're doing everything they can to help their fellow man.
Another question, and for anyone who wants to weigh in, if a patient does go to the dentist and they are still nervous about what they see, and you are all saying precautions are being taken, but if there's a slight chance they're just unhappy, what do they do? I'll ask Dr. Green.
I think that the answer to your question would be the same with or without COVID, in that if you are somewhere and you're getting healthcare, whether that's dentistry or you've got a heart issue or you're diabetic and you don't feel comfortable for some reason, go somewhere else. It's real important to feel good with your healthcare providers. So that's what I would encourage someone to do, is find a place where you feel safe, because there will be a place for you.
Thank you so much. And another question from Molly. Several industries are seeing burnout due to COVID-19 procedures. Is this something patients should worry about when searching for a dentist? And I'll ask Dr. Tongsiri.
Honestly, from our side, as far as the insurance side and having providers, all of our providers are still kind of going strong. If anything, the Medicaid population is rising because of the unemployment rates in Nevada. We're seeing our providers also grow as well. And so for the most part, I haven't seen too much burnout from a dentist perspective. And I don't know if Dr. Funke might see something different with the association, but I think everybody seems, we're also healthcare providers here to stay and fight.
Yeah, and I could add a little bit to that. With the burnout, I mean, it has been quite challenging for the provider and the auxiliary staff because, yeah, there's some additional procedures, but the other part of it is it's just the mental part because you're also trying to care for that patient. You're trying to talk to them, communicate with them. You want to make sure that they do feel safe. They understand what's going on. So it's like everybody else. It's dragged on for a while. It puts a little pressure on you, but you need to, I've got a great staff. We communicate quite a bit. If there's somebody that's, just needs a day off or some time off, we're working with that, so, because we're all here for the long run. So hopefully things will settle down to get to kind of a norm and get the unknown out of the picture. That's the part I think has been the most fatiguing.
Thank you. So just in closing, I don't see any other questions. Hopefully I'm not missing any. I think we've covered the questions. Again, you still can send a question in, but just in closing, I'm gonna ask the panelists to talk about any resources they want people to know about, and also maybe just a final piece of advice about dental care and oral health. So let's start with Dr. Green.
Just kind of piggybacking on what everyone was speaking about as far as the burnout, I agree with that. It's a really challenging time for everyone, but I do want to kind of look at the other side of it also, which is, and I can only speak for myself in our clinic, but for me, with so many restrictions on what I'm personally doing because of COVID, for me, it's a total joy to be at work right now and to be with my staff and my residents and to treat our patients. It makes me feel purposeful during this really challenging time. If I just compared with how I felt when we were shut down, for me, that was much worse. So we welcome everyone to come. We're excited to see you. So I just encourage you to come visit us or your dentist, whoever that may be.
Thank you so much.
I'm sorry, I was going to say, I'll piggyback on that in saying that the students here are just very grateful that patients are coming in. This is a part of their education, and so they are very eager to continue to work. So if people are seeking dental care, please use the dental school as a resource. I mean, we're here, we help the community, and we're more than ready to take on the challenges and face them head on. And we've been that way since all of this started. Students were really excited to get back into the clinics when they first opened. And I still think that they're very able and willing and anxious and happy to be seeing patients. So again, the dental school is a great resource for anyone who maybe is having trouble affording private practice care. Come on down, we're here, we're ready to help.
Thank you. Dr. Tongsiri.
I was going to say, we're definitely out in the community, always trying to partner with other resources in the community, just to kind of share the resources and everything. So if you want Liberty, you could go to libertydentalplan.com, and we have a resource page for community resources. And off of the last question where you stated what people should do if they're still worried about going to the dentist, I we're very active in the teledentistry space right now. I think that's definitely going to become a part of the delivery system going forward. And so I would really encourage people to utilize that as a member or a provider, because again, that's the first interaction with the dentist. If they can make that connection, they can feel a little bit more at ease about coming into the clinic. If I was able to talk and ask a couple of questions before coming in, if I was nervous about it, I think that interaction would help. So other than that, but thank you. Thank you very much for having me.
Thank you. And Dr. Funke.
All right, thanks. Well, we have quite a number of different avenues. We could have people contact our Nevada Dental Association. They would be speaking directly with our executive director, Michelle Reeder. They could always reach out to our component societies, which are, we've got 3 of them. One is for the northeastern area, Elko, Ely, Winnemucca. We have a Northern Nevada Dental Society based out of Reno that does Reno, Carson, Sparks, Gardnerville. And then we have one in Southern Nevada Dental Society, Las Vegas, Tonopah area there. People can even call my office and I'll do what I can to guide people to the right direction too. So there's quite a number of areas just to start and guide them.
Thank you. And just to close out, I just want to mention our panelists again, in case anyone wants to reach out to them. Dr. Amy Tongsiri, the Nevada Dental Director for Liberty Dental Plan. Dr. Mark Funke, President of the Nevada Dental Association. Dr. Rhonda Everett, UNLV Associate Professor in Residence. Dr. Erin Green, Director of Advanced Education in General Dentistry, Residence Program for Roseman University College of Dental Medicine. And so thank you all so much for joining. Remember, it's October is Dental Hygiene Awareness Month. Thank you.